Or welcome back to another session of A Day with your fertility specialist. Thank you for sticking around. Sorry about the delay, but we thank you for waiting. We really do appreciate every time you click on one of these videos, every time you're reminded and you like and you comment. All of that is super important to us, and we're really grateful to have you over here. Today, we're going to be talking about a very interesting topic, as always. We're talking about fibroid surgery and fertility preservation. So, as much as fibroid surgery might be important to you, in just your overall health, it shouldn't come at the expense of your fertility. So, we're going to think and talk about how we can, balance the two and what other options are available for us because fibroid surgery or fibroids are a thing that a lot of women actually struggle with or are diagnosed with, and it seems to be pretty common. So if you have questions about this and or someone has questions about it, you're just curious about the topic, we're going to do a bit of a deep dive about fibroid surgery and fertility preservation. So please stick around with us to learn a lot more. And for that, today we have Dr. Ken on set. Hello, sir. Welcome. It's lovely to have you here as always. Dr. Ken, if you're joining us for the first time or if you've forgotten, is a consultant gynecologist and also an IVF specialist. So you see, these two things are literally his field. So we're going to be getting a lot of information about this. And as always, our live sessions are aimed at giving you much more information so you can make informed decisions and you're more confident and knowledgeable about the things that you might be going through. So, Dr. Ken, we're talking about fibroid surgery and fertility preservation. I mean, these are two things that, I feel like they go hand in hand because you're working on the uterus and you're working on exactly where pregnancy takes place or where the baby grows and things like that. So, fibroid surgery is something that you would say is important, but what actually is it? Why do you even need fibroid surgery? What is a fibroid? I know these are some things that because I've heard fibroid a lot. Fibroid. They'll say, "Oh, somebody had a surgery on the uterus," and you just assume it's fibroid surgery. So, what actually is this whole phenomenon?
Well, I think women generally know what fibroid is. And some of them should be telling us what fibroids
It's
are
true.
right now because every woman of reproductive age, that has been in the urban center
Yeah.
would have heard of the word fibroids. We could excuse women in the rural centers who don't know much about the female anatomy,
Yeah.
the anatomy of the human body. But to a large extent, those in the urban centers know what fibroids are. But then, because you asked, they are just they are benign growths, benign as against malignant, cancerous.
Okay.
So they are benign. Benign is like gentle growth. Yeah, on the wall of the uterus, on the uterus. And when you talk about the uterus, means it could be on the cervix, it could be on the body of the uterus,
Yeah.
and sometimes it could grow into the broad ligament, which are the sleeves that cover the uterus. Okay, so and then on the uterus, it could be uh, located at different positions,
Okay.
which affect the way they cause infertility or the way they present with the symptoms that come along with fibroid. So they are smooth muscle growths on the body of the uterus, and they are genetically determined.
Okay. Well,
Yes, they are genetically determined, and that is why you have them more in the blacks,
yeah.
than the Caucasians counterparts, and then even the genes are different kind of genes
Okay.
that bring about the fibroids, and that is why a woman can have just a single fibroid and may never disturb her all her life,
Yeah.
and some will have multiples and multitudes of fibroids like seeds on the uterine wall or in the uterus. Okay, so it all depends on the kind of genes that it's bringing about the fibroid.
Okay, so at what point would you say fibroid surgery is recommended when there's the diagnosis of fibroid itself?
Yeah, fibroid surgery is recommended if it's posing the symptoms.
Okay.
Yeah, a woman may have a fibroid and doesn't feel any bad thing about it. You know, she doesn't feel any discomfort about the fibroid. Life is going well.
Yeah.
Menses is fine. No any form of discomfort or no impediment to her reproductive life. And then the fibroid is not even growing so big to cause mass effect.
Okay.
So in that case, you don't need to bother it. But a fibroid surgery becomes necessary if there are symptoms that are associated with it.
That presents. What are some of these symptoms?
Yeah, some don't have symptoms, as you rightly say.
Like you said.
But then some symptoms could be the common symptoms are the heavy bleeding, the heavy menstrual bleed or intermenstrual bleed.
So
when women bleed in between menses, so when fibroid is associated with this, then it's about time for the woman to have surgery. I kind of feel that sometimes when we read the Bible,
oh, the woman with the issue of blood.
I don't know, that's what I'm going to. Oh my God. Yeah, because we want to think she's a woman and she's bleeding. She's bleeding from the vagina. Even though the Bible didn't call the word vagina, that's where the bleeding is coming from. And then it's coming from the uterus. So one or two things.
It makes you think, it
means even from the days of Jesus Christ, there were fibroids.
Fibroids since over.
So she probably had fibroid.
Yeah.
Or let me not restrict it to fibroid. She probably had fibroid or endometrial polyps.
Okay.
Adenomyosis.
Oh wow.
Or endometrial hyperplasia. When the lining of the womb is too thick.
Okay.
So those are situations that can make you bleed like that. So one of these 4 things will have been happening to the woman. And she's a woman of productive age.
Exactly.
So very likely to be fibroid.
We'll never know well now because Jesus healed it and there's no remains to go look at and check on that. But that's actually an interesting thought. So why is okay, go ahead.
So the bleeding will be an indication, a reason to have a fibroid surgery.
Yeah.
Because then what the fibroid does is that it creates a large surface, for the endometrium, for the lining of the womb.
Okay.
And the bleeding comes from the lining of the womb. And the larger the surface of the lining of the womb, the larger the volume of bleed. And of course, the fibroid, during the menses, the uterus contracts.
Yeah.
And that is why women have cramps. So the presence of fibroid now, irrespective of where it's located and the number, they interfere with the natural contraction of the uterus to stop bleeding.
Okay.
And so because it is irregular, the contractions are haphazard, they're not synchronous contraction, so bleeding still continues for a very long. So it means that you reach a point where this fibroid, the common ways to that could just be surgery or some other modalities, alternatives to surgeries. So some strange symptoms that fibroid bring about are pain, very bad pain during menses. Sometimes it could be frequent urination. Sometimes fibroid grow towards the bladder, and because it's a mass, it pushes into the bladder, and then it reduces the volume, or the capacity of the bladder. And so if you have just a small volume of urine in the bladder, you feel like going to pee, and so that can happen to you too frequently. Yes, we have seen a lot of people with those conditions, frequent urination, and you think it's diabetes. Because diabetes presents that way, any form of diabetes present that way. But then in this case, it's just fibroid because it has compromised the volume. The bladder usually can take more than 500 ml of urine, but in this case now, you just have like 200
Oh wow.
or 150,
Yeah.
and you feel it's full already because the volume has been reduced
Yeah.
because of the growth of fibroids into it. Then you, of course, you go pee, you keep peeing. That's a gentle symptom, but it's a very uncomfortable symptom for a
Of
woman.
course, yeah.
Can you imagine you are in the office and all
Yeah,
you want to
just
do
need
is to pee, and you can't sleep properly at night? You all want to go and pee,
Can't even
and
drink water
the
comfortably.
quality of life is reduced by
Yeah.
such kind of symptoms. So yeah, you need to go take out that fibroid. Then you could have constipation.
Okay.
Yeah, constipation. Fibroid can cause constipation. Constipation. You find it difficult to defecate. In this case, the fibroid, the uterus is close to the rectum.
Yeah.
So the fibroid grows towards the rectum and presses on the rectum.
So
And
so
so there is no free flow of fecal material, along the digestive tract.
yeah.
And then you are constipated. So when that's the case, you need to have it
I
operated.
mean, you probably
Or
wouldn't
yes, you
even
need to take care of that.
think of
And the
that.
common way is to remove it surgically or by alternative to surgeries.
Okay.
Yeah. Okay, sometimes fibroid cause infertility. For those of us in the reproductive world, we
Yeah.
see fibroid kind of differently from the conventional gynecologists. I remember when I was in when I was doing my specialization training to be a regular gynecologist. You will hear with the knowledge then that don't take out that fibroid. Let her finish having babies before you take out the fibroid. That's
interesting.
crazy crap, man. Because fibroid can give a lot of problems during pregnancy, a lot of pain during pregnancy,
Yeah.
and then the pain could trigger labor. Then you have a premature delivery or even miscarriage because of fibroids. Multiple admissions during pregnancy
Pregnancy.
period,
Yeah.
antenatal period, and then it makes labor itself become unpredictable. It could slow the progress of labor and could cause an arrest to delivery of the baby.
Oh, wow.
So why do you want to say that you should leave
Maybe
it
take
until
it
the
out.
woman is done delivering? Because she may never get through successfully a process of
One
delivery.
delivery.
And then even when she delivers, she could have problem with bleeding.
Because it's
In what
already
we call
impacting
postpartum hemorrhage. Because the uterus won't contract as quick or as soon as you anticipate contraction.
Yeah.
So she could bleed, and the bleeding could be so much that you have to take out the uterus sometimes. Even when you go to operate, sometimes the fibroid may just be on the path to operation if you're doing cesarean section for delivery. So why do you want to allow life to be so complicated before you solve the problem?
Yeah.
So it's advisable to take it out, even before a woman gets a high productive life. Although it's not as straightforward as I'm saying it,
Yeah.
but then a gynecologist will analyze it and have a discussion with the woman before all of this is done. So fibroid can cause difficulty with conception or infertility. It could cause difficulty with delivery process, labor or cesarean section. It could cause abnormal bleeding after delivery that may cause the life of a woman. Then some fibroids could transform to becoming cancers.
Oh, wow.
Yes, like 1% of them could transform to becoming cancers. So fibroid just does all these crazy things that I mentioned to
Sounds
you.
like it.
Yes, I mentioned to you. And so what bothers us the most is fertility, as you're talking about,
Yes,
right?
yes,
Yeah,
yeah.
so that's fibroid.
Yeah. Oh,
Yeah.
that's a lot of things just in one diagnosis, I
Oh, yeah,
would say.
yeah.
But why is fertility preservation an important conversation to have when a woman is diagnosed with fibroids?
Yeah, fertility preservation is important because if you want to consider surgery, you have to think about the safety of your procedure with respect to future fertility.
Yeah.
For those of us who are gynecologists, for instance, if you have to operate a woman for fibroid, first of all, look at her fertility prospects. You ask how many kids she has and how many more she intends to have, because this will affect the decisions to operate, the kind of operations to carry out. Then the kind of energy to use in operating now, because we have all kinds of energies. We have the electrical energies,
Yeah.
we have the laser energies, and we have the mechanical energy operating.
Yeah.
So each of these have a bearing on reproduction.
Okay.
So when you have the reproductive history of the woman, whether or not she intends to be pregnant, you can decide what kind of energy to use in operating her. This is you putting fertility prospects in consideration. So you
Yeah.
don't operate this woman and she ends up not having babies anymore.
Yeah.
There are operations that you may want to be radical about. But if a woman has fertility prospects, you have to put all of that in perspective. So much more than that, even the direction of your cut on the uterus should be precise according to the blood flow in that direction. For instance, in my training in Europe
Yeah.
as a reproductive gynecologist, as a reproductive surgery, we don't cut the uterus the way conventional gynecologists may want to cut it.
Okay.
And that's why we are sub specialists.
Wow.
We cut along the blood flow, for instance, and not across the blood vessels.
Yeah.
Because when you cut across the blood vessels, you transect them. So it affects the viability of the uterus, as maybe small, but it has a bearing
Yeah.
on the viability of the
I mean,
uterus.
even the little things matter.
Every little things matter. No, does matter. Not minding the fact that you are still going to suture
Yeah.
the uterus, but you want to preserve, make moves that conserve the anatomy and the physiological functions
I think.
of the uterus. So yes, so when um, fertility is a prospect, the kind of surgery, it's very important. Because we've seen women in clinics, for instance, and they say that they have fibroid surgery and they can't have babies anymore.
Yeah, I was actually going to ask, how common is it to have people have fertility being affected by having a fibroid surgery? Is it all fibroids that affects fertility, or just certain types, or is it all types of fibroid surgery? Like you're saying, your specialty, you have a different approach, like a different surgical technique, I would say, to do that. So how common is it that having fibroid surgery affects fertility?
So you see, like if a fibroid is on the lining of the uterus, for instance, it's on the lining of the uterus, and then if a very quick, fast, and proficient surgeon is operating,
Yeah.
the kind of surgeon that want to operate everything within 15 minutes. We have some very good surgeons who would do everything so quick.
Yeah.
And then you have this fibroid on the lining of the uterus. The way you take out the fibroid is like you're peeling it out of a cavity. And then if you don't do it carefully, you could peel it alongside the lining of the uterus.
Oh, wow.
Yes. And when you peel it alongside the lining of the uterus, you have created an injury on the lining of the uterus. And then if you're not careful enough to fix it properly, then it will heal with a scar. And now, depending on the size of the injury that is caught on the lining of the uterus, a woman's chance of having pregnancy can be compromised.
Wow.
Then some are so good that they don't even realize that they've done those damage to the uterus. And then the lining heals with adhesions. The lining of the womb, for those of us in reproductive medicine, is the most important part of the reproductive system. Because once the lining is compromised, everything is done for. Reproduction is already perfectly compromised.
Yeah.
And that's what happens if a woman have a D&C, for instance. D&C tampers with the lining of the uterus. And sometimes the D&C is done so crazily well that a woman doesn't recover from it.
Sarcasm.
Oh yeah, she doesn't recover from it because it heals with adhesions. And then because you scrape the entire uterine cavity, you create so much injuries on the uterine cavity. And then it heals and everywhere is adhered together with scars.
Oh, wow.
Maybe embryos or embryos or blastocysts don't implant on scars, and so pregnancy becomes very difficult, and you have what we call intrauterine synechia or Asherman
Yeah.
syndrome.
Yeah.
So when you have that, it's the prospect of getting pregnant is already badly compromised. So the style of operating could be very important.
Yeah.
And then traditional fibroid surgery, the uterus is tied at some point to minimize blood loss. Now, the duration of the tying of the uterus,
It's also something.
it's important, because if a fibroid surgery, like if I'm dealing with clients, for instance, who have had fibroid surgery, one of the questions are, do you have an idea how long your fibroid surgery lasted? Yes, I asked the question
Well,
because it will tell what to expect about the lining.
yeah.
That's if it is an open surgery, for instance, myomectomy. Open myomectomy.
Yeah.
Because you have to tie the uterus. With some form of tourniquet, some kind of plastic cords.
So the longer you have it
So the
tied,
longer you
yeah.
have it tied, the longer you have devitalized the uterus and the lining of the uterus from blood.
Yeah.
And then some people may just leave it 4 hours. You're operating a woman.
Oh wow.
And then you can imagine stabbing you of blood for 4 hours.
Yeah, that's
So you finish a beautiful surgery, and a woman has been condemned not to have babies.
yeah.
That's
really right.
So it's not so in our facilities we don't tie the uterus, even if it's open surgeries, for instance. We don't tie.
Okay.
Yeah, we don't tie.
Okay.
More so if the woman is considering
Fertility.
reproduction, getting pregnant.
Yeah.
We don't tie. We use some other means to take out the blood, even though it may not be altogether complete, but then it's able for you. You're able to operate.
That's the
so
whole
you
point of this topic.
spare the uterus and the lining of the uterus from being devitalized of blood and blood products. So that's the way it is. So when operating, you have to be very careful. Very, very careful.
So techniques are important.
Techniques.
Pre-surgical assessments.
Exactly.
Important.
Exactly.
All of those things.
Yeah.
Oh wow, that's really interesting. The part about tying the uterus and all that. You may not actually think about it when you're under or when you've come out of surgery.
So you must have a doctor
Yeah.
who thinks for you.
Exactly.
Who thinks for you. Yeah, who thinks for you. Otherwise,
your choices.
So that's why the quality of the persons you see matters.
You actually do, yeah.
The quality matters. Quality just matters. So different kind of approaches, different kind of gadgets, different kind of sources of energy, all have bearings on reproductive outcome. Reproductive outcome. Then there are some fibroid surgeries that you do laparoscopically, not open. In this case, you don't even tie. You don't tie the uterus. You just inject a solution into the uterus that takes out the blood. And then you do that, and you bring the fibroids out without even cutting the woman open. That's a keyhole surgery. So that's an excellent one. It has its drawback, but it is very nice doing it.
But can a surgery like that take out a fibroid that's quite big or massive?
You have some gynecologists are daring. They could take out whatever they want to take out by that means, but based on principles, there are sizes you don't go beyond. Usually it takes out a small size of fibroids. Yes, but up to 14, 16 week size fibroids, and if there are not many, just one or two can be taken out by that means, and you know what you're dealing with. But the drawbacks here is that because in minimal access surgery, you have problem with feeling. We call it tactile feedback. The metallic gadgets don't feel.
Like the
way your finger, the pulse of your finger feels. So you may not be able to identify and take out very small seedlings of fibroids. So you have recurrence of fibroid frequently when those are done. But with recovery, return to life activities, and all of that, laparoscopic surgery is beautiful. Very beautiful. Of course, hysteroscopic surgeries too.
It's also
They're
a
fine.
thing.
And then the energy you use for hysteroscopy,
It's also
fibroid
important.
surgeries, it's also very important, you know. So you have different kinds of electric energy, the monopolar energy, the bipolar energy, which is electrical.
Yeah.
Then you have the laser. You know, you also have the mechanical. So in all of this, the the mechanical energy is fine
Yeah.
if you can do that.
Mm-hmm.
Then the laser is at the moment rated to be the best.
Okay.
You know, yeah. Then you have the monopolars and the bipolars. The
That's
reason why
scientific.
these electrical energies are not the best is this, because when you use them, it bonds
Mm.
the uterine lining,
Okay.
and then it doesn't just bond the line of action, it bonds away from
Yeah.
the line of action. Let's say you're cutting a line on the uterus, for
Yeah.
instance. It bonds like 5 millimeters to
Oh,
one side
wow.
and 5 millimeters to the
To the
other
other
side.
side.
So you're causing some injuries to
Mm-hmm.
the uterine lining. But the
Yeah.
laser doesn't give that. It just cuts on the line and
Mm-hmm.
doesn't damage.
Very
Then the
precise.
laser has a regenerative effect
Oh,
on
that's
the
nice.
muscles
Yeah.
and on cells.
Mm.
You know, so it's assumed to be the
The
healthiest. You know,
healthiest.
and we pioneered that in Africa
Fun.
training
Mm.
from the laser institution in
Yeah.
Europe.
Yeah.
You know, in Europe. So we do that. We do the laser a
I
lot.
mean, I've seen a
Yeah,
lot of
yeah,
laser when you
laser.
listen to, I
So
know more
whether
than one
open,
procedures that we do with laser.
or the hysteroscopic
Mm.
myomectomies, we use a lot of lasers
Okay.
because
Well,
it preserves tissue a lot. So your choices are fine.
yeah.
Then the other alternatives like the HIFU
Okay.
and the uterine artery embolization. You know, these are very highly technical surgeries.
Mm.
You know, and from the fields of experts, I said, if you want to have this kind of surgery, you have
Surgery. Yeah.
to you have to think whether this woman cares about reproduction or not.
Exactly. Mm-hmm.
These kind of surgeries are better for those with no reproductive prospects.
Oh, okay.
Oh yes,
Wow.
yeah, with no reproductive prospect. Although you could do a HIFU or uterine artery embolization and you still get pregnant, is okay. But you could have more pregnancies when this fibroid
Without.
are total, because these are HIFUs and embolization don't remove the fibroids.
Okay.
They just devitalize the fibroids, starve them of the blood supply. But the fibroid nodules are still there,
Still there.
but in altered states.
Yeah.
You know, so the lesions are there. They still affect the contractility of the uterus. They still affect the physiological function of the uterus, and that way they reduce your prospects of fertility. But it improves on your symptoms
Yeah.
if pregnancy is
It's
not
not
is
in
not
the
needed.
cards
And
for
so
you.
it's excellent to do
Yeah.
that when pregnancy are not
It's not.
the concerns here. So that's it. So these are different kinds of approach to
Wow,
operating
there's a lot
fibroids.
more than I
Yeah.
than I would have thought. Well, we have a question here from Heroes Conflicts on YouTube. Thank you for sticking around. Thank you for your question. It's actually quite important. It asks, is there a reconstructive remedy for a woman who has compromised endometrium as a result of those causes that were mentioned, like the myomectomy or an overzealous evacuation? Well, this person is, are you not sure in the medical field?
I particularly like the overzealous
Evacuation,
evacuation
yes.
because you see, in Malaga 3 years ago,
Mm.
you know, we had a conference. You know, those of us in the general conference on hysteroscopy,
Okay.
you know, stating that D&C should be outlawed. Yes, that evacuation should be done using hysteroscopy.
Okay.
Yes, so that way you see where you are evacuating the baby from,
Yeah.
and you target it, and then you take out the product of conception from that aspect. Because what D&C does is that it's a blind procedure. You put a gadget into the uterus, into the uterine cavity, and scrape out healthy endometrium
Everything.
and the product of
Products.
conception. Because you're doing it blind,
Yeah.
you want to do it so well that you touch everywhere.
You don't want to miss.
You don't want to miss the target.
Yeah.
And so doing, by so doing, you scrape out the healthy endometrium and scrape out the targets.
Oh wow.
So you're done with that and you've scraped out everything. And people's body don't heal alike.
Yeah.
There's some people that will never recover from that procedure. Why some will recover and would even have it 5 to 10 times, So, but
Yeah.
so when you have those overzealous curettage, for instance, and all of this is damaged, it happens with some fibroid surgeries
As
too.
well, yeah.
To fix. So what you do is in Sophia, for instance, and I've watched him corrected some of those stuff.
Yeah.
Sometimes it's so bad that the uterus is taken all over by scar tissues.
Wow.
So you could take out the scar tissues by doing advanced hysteroscopy.
Okay.
You burn out the scar tissues and treat with some form of stem cells, endometrial rejuvenation, and hormone replacement therapy, and watch the lining grow back again. But this is very difficult to do. And sometimes it takes 6 to 8 to 10 months to watch the lining recover. And in some cases, once the junctional layer, for instance, is the layer just beneath the endometrium. Once it is affected, there's practically nothing you can do.
Yeah.
So women will have recurrent miscarriages, recurrent failure of implantation, and poor menses. I mean, low volume of menses.
Yeah.
A woman finishes D&C procedure or finish fibroid surgery and say, I don't menstruate again after fibroid surgery. It means the lining of the womb is gone.
Yeah.
Or she tells you that, well, I was okay. My menses could flow for 3 to 4 days and the volume normal. But now it's just a day after fibroid surgery. It means the lining has been compromised.
Yeah.
Well, this is actually not intentional, but it's just like a fallout of some good intentions to operate. So yes, when it is damaged, it's difficult to fix the lining of the womb. But then the options of fixing is to do hysteroscopy and then to do what we call a shaving adhesiolysis, where you cut off the scars and hope that healthy lining will grow. Healthy lining will grow. Then you could do hysteroscopy with endometrial rejuvenation, when you use the blood products, whether the platelet-rich plasma or the stem cells or some other blood products, to inject under the lining of the womb, with the hope that they will generate new and healthy lining. We do that a lot in ALPS hospitals, when we have such kind of cases. Sometimes we get success, sometimes the success is elusive, but some people have gotten help from that. So these are the things to do when the lining is damaged. And for me, when doctors are doing my myectomy and I'm interested, I'm preparing for an IVF and I'm not the one operating, I stay over there
and watch.
Say, guy,
don't
be careful. You're coming too close.
You're coming
too close. Yeah, you're coming too close. Please, can we fix this? Yeah. So that's it. Yeah, and
that's interesting. Actually, I mean, it's interesting to know that there can be a way to fix it, although it can be very difficult. So
I
it's
think
best
among all reproductive reproductive gynecologists, one area we protect with every interest is the endometrium. 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 One is bad. It's difficult. It makes life difficult for everyone. You have recurrent failure of pregnancy, recurrent miscarriages, or no pregnancy at all, and worst of all, no menses. Yeah.
So
it's tough. It's tough.
But are there times where a fibroid can be removed and then it comes back?
Yes.
Oh wow.
That's why I say, and the genes that forms that bring about a kind of fibroid differ for different people. Some have this very aggressive gene that the fibroid just grow like seeds. Like a farmer went to the farm to sow tares among the among the crops or whatever. So you see them tiny. Yeah. A friend of mine took out some fibroids, about over 100 pieces of fibroid, nodules of fibroid, over 100.
Oh, I actually saw someone talk about that, Lupita Nyong'o. an actress. She's quite popular. She
Yeah, she
acted
was
in
on.
Wakanda.
Recently, she was
She's spoken about it. She's had
on
fibroids
international TV.
removed,
She had
over
fibroid removed.
100 as
Exactly.
well.
You see,
That's
as
wow.
small as she is, then she has
Exactly.
very
You wonder
plenty
where
fibroid. And
all that
she's
was.
now advocating for women to have their
Yeah.
fibroids checked, right? Yeah.
Yeah.
Yeah, that's it. Usually, when you're at that age, reproduction is happening,
Exactly.
excessive exposure to estrogen, cycle after cycle, and of course, you're a black African woman,
Yeah.
and of course, fibroid is
It's
may just be
already.
knocking on the door. So yeah, so it depends on the kind of gene that forms the fibroid. Some people just the gene controlling some of the fibroid just bring about one or
Yeah.
two, so those are easy to deal with. But some everywhere you touch, just fibroid everywhere, like grapefruits or like grape,
Yeah.
exactly
The way
like grape,
it's on
just
the
everywhere
stem.
like
Yeah.
this. So those ones easily grow back because you may not take them all out.
Yeah.
And some of them at operation, they could be as small as guinea corn or like corn,
Yeah.
sweet corn.
Yeah.
And then you may not pick them, or smaller than sweet corn. I mean, the grain of sweet corn,
Really tiny.
very tiny. So you may not pick them. So you finish beautiful surgery, you pulled out 100 nodules of fibroid, then in 6 to 7 months, fibroids are growing again. Oh man, that's crazy. So it depends on the kind of gene that controls the fibroid, and then it's different for different persons.
Okay, but okay, that's interesting. I mean, I can only think of well, I mean, especially if it's like you said, there are different types of fibroid surgery. There's the open one, laparoscopy. Imagine having an open surgery. They cut through your abdomen, and then it comes back, and you're like, "What?
Exactly.
Why are you coming back?"
I
How?
know some patient comes to us and they say the fibroid grew back and they're angry at the doctor that operated them. It's not the doctor's fault.
Yeah.
It's your body type.
Yeah.
It's not the doctor's fault because the doctor, as much as he can remove, he removes them. He removes them. And then they grow back within a short time. And of course, when they grow so fast, it's good to be sure that you're not dealing with a malignant condition.
Okay.
Because sometimes sarcomatous fibroid grows very fast, but then they are not tiny, but they're just big and fast growing.
Right.
So that's why histology is important. Whatever you take out of the human body, you send to the histopathologist for analysis. So you're dealing with either fibroid or something else. So that's it. So fibroid surgery, fertility preservation is very important.
Well, in regards to fertility preservation, are there some fibroids that you can say can just be left alone? I know you said in the beginning we already spoke about the genes and how some women may have it and have no symptoms at all, but is it every kind of fibroid that may have no symptom that should still be left alone? Or
if you have a reason to open up someone, whether laparoscopically or myomectomy open, to take out fibroid, you should take out whatever you see.
Yeah.
But then if fibroid is associated with infertility, it doesn't matter whether it is symptomatic or not. You should go after it. The reason is this. I said it earlier that we in the reproductive medicine see fibroid a little different from the way the general gynecologists see fibroid. For instance, I know that no matter how small a fibroid is, it affects the contractility of the endometrium. And what do I mean? The lining of the womb, even when nobody feels it, it's beating, it has a waves of contraction, certain frequency of contraction that makes it healthy for baby and embryos to stay, implant, and not to go to the wrong places. The presence of a fibroid nodule in the uterus, not even when it is close to the lining of the womb, affects that balance of contractility. And that can compromise an IVF treatment, for instance. So that's how we see it. We are usually, well, let me not say we, those of us in my category are always tending towards removing it. So we know we're not dealing with something strange. Because how do you feel? You do an IVF, for instance, and you left a tiny fibroid behind. You do an IVF and it doesn't succeed, and there is no obvious reason why it's not succeeding, but for the fibroid. Then you now tell the one, I want to operate you. It makes all of you look stupid.
Exactly. Why didn't you
do that from the beginning? Because that's just it. Of course, if you present that to the woman and they don't want it, it's different. So Every case should be individualized, I know, and should be treated differently.
Yeah.
But this small fibroid you have today may be the big fibroid to deal with tomorrow.
Exactly. Yeah.
And why don't you deal with it while it is small?
Small.
Because when the fibroid gets bigger, it becomes a little more difficult to operate. Yeah, it is not just as I'm saying, it becomes a little more difficult to operate. The chance of having complications are higher.
Higher.
The chance of having worse symptoms are there, and pregnancy complications are higher with it. Yes, the cutoff they say is about 4 centimeters fibroid, but then we still think differently.
Yeah.
We measure the distance of the fibroid to the lining of the womb.
It's lining there.
So if I'm
Very important.
doing an ultrasound, for instance, for fibroid, I'm looking at the distance of the fibroid to the lining of the womb, not just when it is compromising the lining of the womb.
Yeah.
Because even the fibroid produce chemicals that alter implantation.
Oh wow.
So this is physiology
Lot, yeah.
of the chemicals produced by fibroid. So you see, what you do depends on what you know.
Yeah.
Yes. So we see differently, so we'll always think differently because we are involved in different level of researches and different levels of professional deliberations. Yeah.
Okay, well, we have another question. Well, our viewers are very interactive today. Thank you for that. From Olawumi on Facebook, they ask, "What is the cause of fibroid, please? Also, how true is it that fibroid is associated with not having early sex?" That's why I've been giggling, because I saw the question and I'm like, wow.
No,
okay.
it has nothing to do with sex.
Yeah.
It has nothing to do with sex. You know, fibroid is genetically determined.
Yes,
Okay.
like you
So
said.
the Negro race, the African, the Africans, I mean,
Yeah.
the black, the brown color,
The brown color.
have genes for fibroid. And these genes usually are activated when the reproductive life has gone for a while.
Yeah.
You know, women in the reproductive age who have constant estrogen exposure. And you have a constant estrogen exposure when you're not getting pregnant.
Yeah.
Because every month your body produces estrogen in cycles. Estrogen, progesterone. So the constant exposure to the estrogen in your reproductive age predisposes you to having the fibroids.
Okay.
You know, genetics is one,
Yeah.
then the constant exposure to the estrogen, which is what happens when you're menstruating. I mean, in your regular cycle, because in the phase of your cycle, estrogen is produced before progesterone is produced. So that continuous exposure to estrogen can cause fibroid, polyps, and some other stuff, you know, and then for a woman of reproductive age. So these are two main causes, genetic and exposure to estrogen. Then, of course, when you are advancing age, reproductive age, and then you're not pregnant. But how does pregnancy becomes an issue here? When you get pregnant, the constant exposure to estrogen is stopped. Do you understand? So you have a break in that exposure because pregnancy hormones come all over the places and all of that. So you don't have that constant exposure. So you have a break. And so you could have a delay, you know, in getting the fibroids. So of course, the diets now play some role. These are just some factors that would improve, that would increase the risk. The westernized kind of diet that Africans eat, the meat pies, the snacks, and all of that. Okay, so they play a role. So those are the causes of fibroid, genetic.
Okay.
Yeah.
Well, I hope that answers your question. Sex or having early sex has nothing. How about the early pregnancy? Because you're saying, you know, like when you get pregnant, I mean, if the fibroids have not yet developed, the pause in that estrogen secretion, does it actually, now let's forget the early sex, but the pregnancy one, does it, how would I say, reduce the risk?
That's what we're saying.
Exactly.
Yeah, it does. That's what I'm saying. Yeah, it does reduce it.
Okay.
Yeah.
So one more question before we try to round up, because we've been here for a bit and I think we've spoken a lot about fibroid surgery and fertility preservation. This was a question when we're talking about tying of the uterus. They just didn't really understand the tying of the uterus or why it even needed to be tied, you know, what exactly does
Someone
it
asked the question?
surgery? Yes.
Okay, traditionally, when you're doing a fibroid surgery, you have the place where the blood vessels, the uterine artery, it goes into the uterus.
Yeah.
So, and if you don't stop the flow of blood to the uterus while you're cutting through the uterus, you're going to have massive bleeding. And your man will have been gone
Before
before
you
you go
even
halfway the
move.
surgery, depending on the size
Size
and
of
number of
it.
fibroids
Yeah.
you're
Okay.
doing. Okay,
Mm.
so you stop the blood flow,
Mhm.
and before the surgery,
Just to minimize
so to
bleeding,
minimize
basically.
bleeding. Now, often in this part of the world, it is tourniquet. I mean, the urethral catheter,
Mm.
which is a plastic, just a plastic cord that is used.
Okay.
So there are other gadgets that are used,
Mm-hmm.
like the uterine clamps, for instance. You can just use to hold the uterine artery,
Mm-hmm.
while you are doing it. So that's just a tying of the uterus, just to prevent the blood flow to the uterus.
Okay.
And if that is done for too long, it compromises
Yeah.
the health of the uterus
Exactly.
itself.
Yeah.
Yeah.
Because you're starving in
You're
in more
starving it,
blood
yeah,
than you need. So.
exactly. So it's advised that if it's getting past some time,
Mm-hmm.
you free it a bit to allow some blood and tie back.
Okay.
Yeah.
That's fine.
Mhm.
This is I'll just say just round up a bit. We've spoken about fibroid surgery and how it could be very important, and how to go about it in preserving fertility. But are there other alternatives to fibroid surgery for women with fibroids that also want to maintain fertility?
Well, if fertility wants, yeah, there are. We've said the best is to take out the
Yes.
fibroid. If taking out the fibroid is not acceptable to these individuals, they could do the HIFU,
Okay.
which is the use of high frequency of ultrasound waves to devitalize the fibroids. This doesn't take the fibroids out totally. It devitalizes, stop the blood flow to the fibroid, and the fibroid shrinks
Yeah.
over time. That's one. The other one is the use of uterine artery
Yeah.
embolization.
You said so.
So you could send some foams,
Mm-hmm.
some alcohol material through the veins. You track the veins, the blood vessel that goes to the uterus, and you inject it into it. It goes and block the blood supply to the fibroids. And then the fibroid stops growing,
Yeah.
and it devitalizes and shrinks with time. But the fibroids are still there.
Still there.
Sometimes the symptoms may even persist. And we've seen a whole lot of women coming from the European nations where they do a whole lot of this, coming to have fibroid surgeries in Nigeria, haven't had the uterine artery embolization for fibroids. The same thing with HIFU. And as I told you earlier, any lesion on the uterus that is still on the uterus where you're doing assisted
Already
reproduction
affecting
is affecting
the
the
lining.
physiological normalcy of the uterus, of the lining.
Yeah.
And that can affect the waves of contraction that would negatively impact on implantation. So you still don't want it, but then you can still get pregnant,
Yeah.
but not the frequency, may not be as high as those who have removal of the fibroids by surgical means, either laparoscopically, hysteroscopically, or open surgeries.
Yeah.
Yeah. So that's it. So those are the alternatives. Of course, the use of medications to shrink them.
Okay.
So if you use medication to shrink them, it doesn't have a reproductive benefit. It just helps the symptoms.
Yeah.
Because the fibroids are there. If you go to the reproduction, they grow back
Still
again,
there.
and then they can cause the symptoms they are causing. So those are the other alternatives to doing the fibroid kind of treatment. Yeah.
Okay. Well, thank you so much, Dr. Ken. This has been quite
Fibroids.
insightful and
Oh, yeah.
fun to talk about.
But I have a question to people. Yes,
Please
if
do
they can
ask.
answer me, I'll be very happy.
Yeah.
A friend of mine just, we're colleagues, friend. He may be on TikTok watching.
Okay.
His name is CIA on TikTok.
Oh, he's
CIA.
here.
So CIA, in case you are watching, where do women? What do they think about that makes them allow this fibroid 6 weeks into pregnancy? How do they manage to allow that happen?
Yeah.
You don't see that in Europe, for instance. The fibroids you see in Europe are tiny, tiny fibroids. So if they see the African size fibroid,
Yeah.
it's crazy because it's difficult to manage.
Yeah.
You understand? But yeah, good enough. Nigerian and African gynecologists are masters in managing African fibroids.
Exactly.
I remember here the highest fibroid in the museum in Alps is 7.5 kg. I don't know, 7.5 kg, which up to 2 sides of a baby.
Exactly.
Yeah, because a regular baby 5.
Little,
So 7.5 kg is 2 plus 2
yeah,
two babies
that's two
plus.
babies.
What were they thinking about? What were they so scared of? And this is because there are a lot of myths and misbelief
Yeah,
about
exactly.
fibroid, that when they have surgery, they will die.
Yeah,
If they have surgery, they will not give birth. Just 2 days ago, we had to take out a woman's uterus because of fibroid. She was bleeding
wow,
almost to the point of death.
really
And
bad.
because
That's,
she's already very kids, the uterus is no longer useful.
yeah,
And then we just had to take it out.
yeah. I've had a relative as
She
well who had to
ran,
have her
she
uterus
ran
removed.
away because we mentioned surgery before. She became so was out. Even still, the uterus was taken out.
What?
Yes, because what use it is. So I'm saying it's the question. I'm trying to help them answer the question. Anyways, you don't need to be scared. It's not the first story that kills people. You know, you can there's all kinds of causes of death when surgeries happen. And it's not only surgery that kills people. You know, in the Gulf region, it kills so many people. And we wish that would stop and peace be restored and people have themselves with dignity. People die naturally. So there's so many causes. Road traffic accidents, you know, hypertension, diabetes, and illness, malaria, they kill people. And people demonize
Surgery in general. I know, just think that is surgery. That is like,
I have surgery. I have surgery.
yeah.
Um, I was so that's when so I ruptured my meniscus. So
Yeah.
I was having the surgery. My eyes were open. Anesthesia, my eyes were open. And I was part of the surgery myself, you know.
Yeah.
Yeah. At some point I felt like doing something better than
Just
some of the surgeons. And I'm a minimal activist,
yeah.
so you can imagine what I'm talking about.
Yeah.
So surgery can be fun,
Mhm.
and we need to stop and, and making people get scared. Fear causes more problems than surgery. I've had people who have died of bleeding for surgery, for situations like this by just God will come down and maybe just take out the pathology. Now with the issue of blood,
Yeah.
I guess hers was direct contact with fibroid or polyp. Yeah, that happens. Yeah, so for a good number of people don't have wood.
Especially
So
if
they
it's seriously
put the sheet and just trust the doctor. Get your surgeries.
affected the struggle. With black women to be strong
Ex-
person. You can be a bit sometimes it's perfectly fine. Yeah, thank you. Yeah. I feel like have passing a conversation that well live sessions we do. I feel like because I was thinking around it's a very interesting topic. If you didn't share this one, please do appreciate someone who fibroids or is suffering from one of the symptoms that we mentioned around fibroids. So, but sometimes actually go after. When you're trying to preserve fertility, you've also been diagnosed with having fibroids. specialist because there's different techniques. There's something that you look at fibroids differently compared to your so yes, you might want to look at the fertility specialist. So after that, it's always nice to have you around. I'm gonna have to say bye because I know I've kept you for such a long time. But stick around because I'm going to do the practice for live at 3 p.m. on all social media platforms of Fertility, Facebook, YouTube, Instagram, TikTok, where else? Anywhere that you go live, we're live on there. So yes, join us next time. Interesting conversation.